Hello people, in this video let us look at insulinoma. Insulinoma is basically tumor of the islet cells of pancreas. So it's the pancreas that is making so much insulin. Okay, so basically this is your pancreas here. What you see here, what you see is your pancreas. This is your pancreas, and inside it you have acini and then ducts. So here you have the acini, and in between these there are some alpha and beta cells. So here you have the beta cells. These beta cells are making lot of insulin. So this guy will have a lot of insulin. So let us look at this. This is a most common functioning islet cell tumor. Okay. So basically it is an endocrine disease of the pancreas. Okay. There is excess hormone. Which hormone is excess? Insulin. Very good. Then it is a multiple in MN syndrome, right? In MN1, these people can have all these conditions, right? One of them can be insulinoma, MEN1, Wermer's syndrome. They can have insulinoma, okay? So, islet cells can be alpha cells, alpha, beta, delta, G, okay? So, the beta cells will make insulinoma. If there is, if it makes excess insulinoma, the presentation will be hypoglycemia. What these people will have less? Insulin is more, yes. Insulin is more, but what is less? Glucose, blood glucose will be less. So, what will happen if blood glucose is less? Hypoglycemia. These people can faint also, right? So most insulinomas will be where in the tail of this pancreas. They will be mostly benign, but they can be malignant, and there can be multiple also. Okay, it can be a single adenoma. So multiple also it can be single also, and there can be hyperplasia, or it could be carcinoma, that means malignancy, right? Then now look at the clinical features. These people will have hunger pain. So that means on if they have pain on an empty stomach, you will think it's a duodenal ulcer, right? It mimics duodenal ulcer, so you should not think it's duodenal ulcer. As it becomes severe, what will happen? Giddiness. We told you, right? These people can have faint attacks because of hypoglycemia. They'll have blurring of vision, diplopia, all that. In late stages, they can have epilepsy, semi-consciousness, and coma. Please understand this. Hypoglycemia is so dangerous. You can have epilepsy. That's really bad, right? Epilepsy. Some people who have epilepsy, you should check them whether they have hypoglycemia, isn't it? Please keep this in mind. Now let's come to Whipple's triad of insulinoma. See, this morning this guy gets up, he has hypoglycemia because he's fasting, right? Then you just check his fasting blood sugar, it is less than 45. Normally yours and mine will be around 70, let's say. And then he takes glucose and then he becomes fine. This is Whipple triad. What is this? Whipple triad, insulinoma. Okay. So what will happen here? The patient had symptoms of hypoglycemia. Then when you measured, it is 45. Then his symptoms are relieved on taking glucose. Very good. Now, what will you check? You'll check. This guy has come in with Whipple triad, right? You'll check. Does he have increased insulin or low insulin? This guy has increased insulin. What about C-peptide? Is C-peptide more? Yes, C-peptide is more. If C-peptide is more, that means what? I think this guy, it's his own insulin kind of a thing. So it is insulinoma. But what if C-peptide is less? That means he's taking some insulin from outside and he has had a hypoglycemic episode. Exogenous insulin. But if it is C-peptide, is more insulinoma. Nice, right? Or he has hyperinsulinism of infancy. Or he's taking other drugs which are increasing his own secretion of insulin. Guys, these people know they have more insulin. So what will happen? Insulin will protect the lipids. Correct? So insulin is more. So what the job of insulin is? It has to burn glucose. It has to burn what? Glucose. So it will protect lipids. So lipids will become more in these people. So these people will become fat, right? These people will have obesity. So, but understand this is the reversible cause of weight gain. So if people have weight gain, then at least this is a reversible cause of weight gain. And then, this is some interesting it seems. Most common functioning islet tumor. Okay, there's some functioning word they're using here. Functioning islet cell tumor of pancreas. That's why more, it's more, right? Secreting more. Most are single. Yes, we told you single can be the single adenoma. Mostly multiple in MEN syndrome. If they have MEN syndrome, then it will be multiple. They are mostly benign. Can't say always. It's occurring tail and body. Mostly in the tail. See, like this. If you write for everything, you can write mostly. Bizarre behavior, confusing type due to hypoglycemia. Poor guy, he has hypoglycemia, he behaved bizarrely. Diagnostic test, what will you do? You'll check insulin during fasting hypoglycemia. You're not checking blood glucose. Here they're saying you can check insulin levels itself. See, glucose will be less, but insulin will be more, isn't it? See, this is my insulin level actually. It is 7. So I don't have insulinoma. My insulin levels are not more. But if insulin levels are more, then what is it? Insulinoma could be. Or this guy has taken insulin from outside. So he'll have very high levels of insulin. Then important, you should before surgery, you should localize the tumor. Okay, you have to do surgery, that means. Then you can do ultrasound, CT, MRI, whatever. They can be enucleated when they occur in the head. In the head, if it is there, you can easily enucleate. Okay. Most insulinomas are small only. Small, single, multiple and men's. Okay. So this is the insulinomas interesting most, it seems. So basically, you'll have to localize the tumor and you'll have to operate on it and remove it. Okay. If it is in the head, you can enucleate it. That's it, right? Oh, investigations. What investigations to do? You will find that serum insulin levels are high. Yes, we told you this. Proinsulin levels and C-peptide also are very high because he is making his insulin, right? So he has all the proinsulin, C-peptide, everything he has. Then, persistent hypoglycemia, blood sugar levels are less. Yes, we told you. That's why he has hypoglycemia. Then, if you give glucose, he is relieved. This is suggestion of insulinoma. Relieved by glucose, correct? What is that? What is that? Triad? Correct, Whipple's triad only. So if you do CT, USG, you can demonstrate the tumor. Okay. Then you can do angiography to know whether the blood vessel, etc. you can know. Then how will you treat? They told you enucleation you have to do. Resection of the tumor. And you may have to remove a part of the pancreas. Distal pancreatectomy you may have to do in selected patients. DiazOxide is given to suppress insulin release. Okay, this is the drug to suppress insulin release. DiazOxide. For inoperable islet cell carcinoma, how do you say this? Streptozotocin is the best. So for carcinoma, that means if it has become inoperable carcinoma, first of all it's carcinoma we don't like, over that it's become inoperable, then you give this so difficult to say it, Socin, okay? It's a chemotherapeutic agent, okay? So guys, DiazOxide, Zocin you have to remember. In this video we looked at insulinoma. Bye bye.